This video is related to a mental disorder, schizophrenia, and made by Harpreet, Jaspreet, Gunjan, and JC. What is schizophrenia? Schizophrenia is a long-term mental disorder of a type involving a breakdown in the relation between thought, emotion, and behavior, leading to a faulty perception, inappropriate actions and feelings, withdrawal from reality and personal relationship into fantasy and delusion. Now I am going to talk about a person named JC. He looks normal in this picture, but there's something more going on behind the scene. He is suffering from schizophrenia. He was diagnosed with this disorder in his early 20s. Then he went to the doctor, and he told the doctor that he doesn't find life pleasant, calm, and manageable. He doesn't like to communicate with people. JC told the doctor about his symptoms, like he experiences a lot of anxiety when he is doing anything like studying and working. Sometimes he doesn't like to be sociable, sometimes he prefers to be alone. Auditory hallucination is hearing non-realistic voices which does not even exist. Delusion is about thinking and believing in unrealistic thoughts. For example, he keeps on thinking that someone wants to hurt him. This is flat affect. He's not showing any facial expression. The doctor told JC about the treatment for schizophrenia. He prescribes him some medicines such as aripiprazole, acetaminophen, and clozapine. There are some therapeutic treatment for schizophrenia, such as individual psychotherapy, cognitive behavior therapy, and cognitive enhancement therapy. Educating the public about schizophrenia. There are misconceptions about schizophrenia, so people need to get educated about the symptoms and facts. It is crucial not to judge or negatively label them to avoid public mistreatment. There are 3 different types of symptoms, one of which is positive symptoms. Those are mental behaviors that healthy individuals do not usually experience, such as hallucinations, abnormal thinking, agitated movement, and disorganized speech. There is negative symptom. It is a type of symptom that interferes with regular emotions and behaviors, such as flat affect, lack of pleasure in everyday life, difficulty starting and continuing activities, and lack of social communication. Lastly, there is cognitive symptom. It varies to patients. Some experience mild or extreme forms of low cognitive capabilities, such as learning and understanding new information, inattentiveness, and unable to store new memories properly. Factors. The causes are unknown, but there are leading factors we can point out to. Genetic factors. During pregnancy stage, the neurodevelopment problems may occur, such as maternal stress, maternal infections, pregnancy, and birth complications could be linked with schizophrenia. As for environmental factors, childhood adversity, low income status, excessive use of marijuana, and a combination of obesity and stress increases the probability of mental illness, such as schizophrenia and depression. Geography matters. Research shows that Americans who suffer schizophrenia are more likely to hear scary, abusive, and commanding voice, while people who suffer schizophrenia in India and Ghana tend to hear voices that are more playful and friendly. As for JC, there is hope for him. Schizophrenia may interrupt study sessions, but with enough grit and perseverance, he can be a lawyer and a professor, just like professor/lawyer Edwin Sachs.
Created using Powtoon.